This is a tutorial. My topic is alcohol, drugs, and baby boomers. Are you ready? What are the baby boomers? Is someone who is 65 years old or older. The proportion of the population that is over the age of 65 is growing globally. Those in the baby boomers cohort will soon all be age 50 or older. Along with increasing numbers in this older age cohort, there is a powerful upward trend of alcohol use and other drugs in older adults. Let's see a short video about these baby boomers.
Until the arrival of the last part of the millennial generation, baby boomers born between 1945 and 1964 were the largest ever. Boomers were known for being anti-establishment. They were only interested in sex, drugs, and rock and roll. And they protested everything else. Or did they? This is where the real nature of the silent generation appears. While boomers were certainly heavily involved in the protest culture, they didn't lead it. Those leaders came from the silent generation. Think of people like Jane Fonda and Tom Hayden, both from the silent generation. The boomers stretched generational diversity even farther than the silent generation. But as a group, they did seem to agree on one thing. They needed a job. And once they found one, they realized that they could acquire material goods. Not nearly as frugal as their ancestors, they had certainly heard of the stories of the Depression but hadn't lived it. They went on a buying spree. They also soon realized that they are the establishment, and they kind of like that. Of course, not all boomers are the same. In fact, boomers are the first generation that is difficult to completely define. The next one will be the millennial generation. But first, we need to look at the generation caught in the middle, Generation X.
The substance abuse is the consumption of illicit drugs, alcohol, and tobacco. The four main categories of psychotic drugs that baby boomers consume are the hallucinogens, stimulants, opioids, and depressants. Let's see another
You may
short
think of it as a problem that plagues the young, but a new study finds drug and alcohol abuse is increasing among people old enough to be their parents. Of those seeking treatment for substance abuse, more than 12% are 50 or older. That means the percentage has nearly doubled in the past 16 years. Ben Tracy has more.
Cleaning up the beach is now her daily addiction, but this 56-year-old who doesn't want us to use her name is also cleaning up her life. She's been on a steady diet of alcohol and marijuana. She's not alone. A new study shows that a growing number of Americans over 50 are in treatment for drug and alcohol abuse. Between 1992 and 2008, heroin admissions jumped from around 7,000 to nearly 37,000, and marijuana from just 600 people to more than 6,000. Those seeking treatment for cocaine abuse rose from 2,900 to 26,000. Alcohol is still the most widely abused drug of those over 50, but the use of illicit drugs may stem from two things. The population is getting older, so there's simply more people using, and the baby boomer generation grew up at a time when drug use was prevalent.
The earlier people initiate use, it increases the chances that they will continue to use throughout their lives.
Dr. David Sachs says another factor is that today's retirees have too much time on their hands.
They have money, they are healthier, and they're bored.
But for some former users, life is just now beginning.
Among those 16 years and older, 2.36% of men and 0.38% of women met criteria for alcohol abuse. Averaging the sexes, 1.21% of the population 65 years or older met criteria for alcohol abuse. Rates for alcohol dependence were lower, 0.39% in men and 0.13% in women.
Well, you may not think of them as the type to get hooked on drugs.
We're talking about baby boomers, and as they age, they are using drugs in record numbers. Some 5% of the 78 million boomers admit to abusing drugs, and experts are calling it a booming addiction.
When I was growing up, everybody was getting high.
Like many baby boomers, this 54-year-old says he spent years, decades in a drug-induced fog. First smoking marijuana when he was just 15.
I liked it. I became a true pothead.
Despite his middle-class upbringing, Jeff, who doesn't want us to use his last name, moved on to pills, cocaine, and worse.
You could find heroin everywhere. Just the same way you could find, pills everywhere.
But that was then. Now he's clean.
I don't want to lose myself anymore. I like who I am now.
But experts say he's not alone. A recent government report shows that record numbers of baby boomers are in treatment for drug abuse. The number of people over 50 treated for heroin abuse more than doubled since 1992. Those treated for cocaine addiction quadrupled, and even more shocking, 5 times as many boomers were in treatment for prescription drug abuse. A lot of boomers grew up doing drugs, and experts say many never stopped or are turning to them again to help cope with the normal stresses of aging.
I think it's possible that they're lonely and they're sad and they're kind of isolated, and so they, that's a way for them to feel good for a while. And that worked for them in the past as well, so maybe it'll work now.
And aging brings with it aches and pains and the potential for prescription drug abuse.
Never thought this was going to happen to me. I never gave it a second thought.
3 years ago, Sharon, who also doesn't want us to use her last name, got hooked on oxycodone, prescribed for a back injury.
It was severe. It was intolerable.
She's clean now, but her addiction was swift and intense.
It rules your life. Because the only thing that you think of is the pill. Is that high?
According to the Centers for Disease Control, unlike other generations, boomers are facing a vast array of health problems, including high blood pressure, obesity, diabetes, and arthritis.
Over time, the cartilage wears out.
Baby boomers are facing arthritis both because of high rates of obesity and because some are staying more active than their parents' generation.
We do see that people that need joint replacement surgery at a much earlier time point than we did in the past. That is no question.
But the good news, many baby boomers are staying active and living life to the fullest with the freedom to finally do what they want.
I have actually nothing on my mind. Nothing going on up there, so I'm having a really good time and I'm enjoying myself.
I think it's a good time. I think it's a good time. I think it's a freeing time. And I plan on traveling. I plan on, my children are grown, so I'm thrilled. I'm thrilled. I don't even like to babysit anymore.
Well, we can tell you that rehab centers around the country say that they've got more baby boomer clients now than at any time.
There is a growing evidence that female sex is a major risk factor for problems associated with prescription drugs abuse. Older women are more likely than men to consume benzodiazepines. This may be associated with recent divorce or widowhood, lower educational level, lower income, poorer health status, depression, and/or anxiety. There are 2 groups of older alcohol dependence patients, those who became dependent before age 60 years and those who became dependent after age 60 years. There is also a group of older adults who do not meet criteria for dependence but are at the risk for drinking problems. Cognitive dysfunction can be caused by a number of organic and external conditions, including medication. Alcohol causes cognitive impairment in dose-related fashion in the acute settings. Chronic alcohol consumption has been shown to cause persistent cognitive deficits with associated cortical atrophy and ventricular dilatation on brain scale. Consequently, it is important to recognize the underlying incidence of diminished mental function in the elderly, which range from mild cognitive impairment to dementia. So, the conclusion of this topic is that the well-documented prevalence of elderly substance abuse and the aging of the baby boom generation indicate that substance abuse and its treatment in the elderly will surely be one of the most pressing public health concerns. Consequently, there is a need to develop more time-efficient and valid screening instruments to help identify older adults who are at risk. Thank you.